Welcome, everyone. We'll just give a few minutes for everyone to join. Thank you. We're just waiting a little while for everyone to join. I think we'll start now. Well, good morning, good afternoon, good evening to everyone, and welcome to the first EPI WIN webinar of 2025. Wishing you a very happy new year, and I hope you have a wonderful year ahead of you. I'm Supriya Bezbarwa. Thank you for joining this WHO EPI WIN webinar on the topic of developing a dynamic workforce for One Health, WHO approaches and applications. We all know how important the One Health approach is, but in practice, how can it be implemented? So today's webinar will introduce the newly launched Workforce Development Operational Tool developed by WHO, FAO, and WOA, as well as to let you know about WHO's overall approach to workforce development. We also have with us colleagues who will share with us country and regional examples of implementing this tool. For those of you new to EPIWIN, it stands for the WHO Information Network for Epidemics, for Science and Knowledge Translation in Health Emergencies. Our goal is to translate the information and science in health emergencies and make it accessible, understandable, and relevant for evidence-informed actions and decisions in health emergency preparedness and response. So today I'm excited to share with you that we have a great panel. We have to provide the welcome remarks. We're privileged to have Dr. Stella Chungong, Director, Health Security Preparedness. She will give the opening remarks, and those of you who are regular in EPIWIN will know her well. She's been a great supporter of EPIWIN. We will then hear from Dr. Matthew Boniol, statistician in the World Health Workforce Development at WHO, who will provide the overall health workforce development approach. Dr. Ong An Prasan Fanik, who's technical officer in the Human-Animal Interface team, will let you know about the workforce development operational tool that I just mentioned. And then we have with us, and we welcome warmly, two eminent colleagues from the West African Health Organization. Dr. Virgil Lukoso, Acting Director for the Healthcare Service Department, and the regional One Health focal point will describe how people were trained and the training of trainers with this tool. And Dr. Guy Gerard Kwame, who's a regional One Health eminent expert, will also share the experience from a country, which is Côte d'Ivoire. Before I go on with the webinar, some housekeeping. Those of you who are regulars will know this. This webinar is being live streamed to the EPIWIN YouTube channel. The webinar is being recorded, and afterwards the recording will be available from our website, and the address will be shared with you on the chat. We love to know about you. Our participants are most important to us, so we invite you to post your name, location, organization in the chat box. We would love to hear where you're joining from, and we'd love to hear your comments. If you want to share experiences, chat with other participants, do so in the chat box. But if you have questions, please put your questions in the Q&A box, not in the chat, so we can more easily track them. Before I invite Dr. Stella Chunglong, very quickly, and those of you here know the drill now. We would like to hear from you through Slido. So give me a second. Can you see the Slido poll? Join us at slido.com, hashtag 2804480. And we want to know from you, are you currently working on One Health? Yes or no, or partially? Oh, great. Most of you are working on One Health. Vast majority at the moment. Right. So 50, more than 50% working on One Health. Great. So I will leave the Slido on, so please continue to share with us the answer. But I will stop sharing my slide right now, and I would like to welcome Dr. Stella Chungong to give the opening remarks.
Good morning, good afternoon, and good evening to you all. It is with great pleasure that I welcome you to this important webinar on a critical topic, that of developing a dynamic workforce for One Health. The global health landscape is evolving rapidly, and as recent emergencies have shown, our ability to prevent, detect, and respond to crises relies heavily on having a well-prepared and skilled workforce. I see on the screen that 55% of people already are working on One Health. And most of you know these statistics. But zoonotic diseases cause an estimated 2.5 billion cases of human illness globally every year. Over 60% of existing human diseases and 75% of emerging ones originate from animals. These figures highlight the urgent need for integrated approaches such as the One Health approach, which recognizes the deep interconnection between humans, animals, and the environmental health. Without a skilled workforce, this vision cannot become a reality. Today, we will explore the Workforce Development Operational Tool, which is part of the Tripartite Zoonosis Guide and one of the several One Health assessment and capacity strengthening tools, which was created by the WHO's Health Security Preparedness Department, the Food and Agricultural Organization of the United Nations, and the World Organization for Animal Health. The United Nations Environment Program, UNEP, the newest partner of the quadripartite, has also been increasingly involved in the process of developing and implementing these tools. This tool is more than a guide. It is a structured framework designed to help countries strengthen their public health and emergency workforce. It focuses on three main areas. One, defining essential functions and services which are required to manage zoonotic diseases effectively. Two, identifying competency-based education and training to align workforce skills with those needs. And last but not the least, mapping existing workforce capacities to pinpoint gaps and prioritize investments. Since its launch in December 2024, which is just a month ago, the tool has already been used in 4 countries, and its first regional training of trainers was conducted in West Africa. Demand continues to grow, with at least 3 additional regional and country level implementations planned for 2025. These efforts are helping countries meet their obligations under the international health regulations and to strengthen health security. So what does this mean in practice? For governments, it provides a clear methodology to develop workforce plans that are tailored to their very specific needs, ensuring that they are not only meeting immediate demands, but also bringing and building long-term resilience. For partners and stakeholders, it offers a shared framework to coordinate efforts and maximize impact. And for health workers, it ensures access to the training and resources needed to perform their roles effectively. Workforce development is about more than technical skills. It is about preparedness. It is about trust. It is about resilience. When a public health crisis strikes, it is the workforce that stands on the front lines, providing care, managing the risks, and ensuring that systems continue to function. By investing in workforce planning and capacity building, we are not only protecting lives, but also strengthening the foundations of global health security. This work also reflects the collaboration of the tripartite organizations, now joined by UNEP as part of the quadripartite. Together, they are driving the innovation in how we address health threats at their source, with a focus on One Health approaches. The tripartite zoonotic guide and its operational tools are practical resources to address zoonotic diseases. And today, we are spotlighting a crucial one, workforce development. I want to take a moment to thank the team here and in our regional and country offices, but particularly Stefan de la Roque, as well as AIM and their team. Some are sitting around the table, thank you, as well as our EPI WIN team and our valued partners, those from the WHO's Health Workforce Department, from the West African Health Organization, WAHO, for their contributions, really critical contributions to this effort, and for supporting this session. Thank you all again for joining this webinar.
Thank you very much, Dr. Stella, for those welcome remarks. I would now like to invite Dr. Matthew Bonnier to tell us about the WHO Health Workforce Approach.
Thank you, Dr. Supriya. Good morning, good afternoon, everyone. I will have a short presentation just to illustrate the overall health workforce approach to workforce development. And I will illustrate it with the global roadmap on workforce, national workforce capacity for essential public health function, because that makes the perfect link to the workforce development operational tool for One Health that will be presented. So the first thing is that globally, health system challenges are increasing in number and in complexity, and often facing multiple and overlapping stressors and shocks. And we cannot have an individual response to each of these specific challenges, but we need to develop systems that are capable to meet the diverse challenges. And this calls for flexibility, diversity of health system capacity and operation that includes workforce, information systems, supply chain, etc., to meet the population needs. The health and care workforce is a key pillar on the health system. It is critical for providing universal health coverage. It is critical for providing health security, and there can be no health without a workforce. And beyond the health sector, the health and care workforce has important roles in several other sustainable development goals that you can see on this slide. With around 70% of women employed as health and care workers, it is related to gender equality, with the sector largely employing skilled workers, in particular from the public, and as a growing economy, it is related to economic growth and decent jobs. So to ensure that countries are equipped with properly trained, enabled, competent, and protected health workforce, the WHO follows the following theory of change, which is data, dialogue, decision, dollar. It is aligned with evidence-based approach, and it roots decision to strong data in the first place, strong data analysis and benchmarking, and good monitoring process. And for the health workforce, this is done through the National Health Workforce Accounts. Once the evidence is gathered, and because of the multi-sectorality of health workforce, a dialogue is needed between sectors, between partners to reach a consensus. And then the decision can be taken in various shape and form, policy, strategy, plans, and then funds identified to sustain the change and the improvement. So this is really the overall theory of change that WHO follows on workforce. And to better understand the health and care workforce, it's important to also capture its complexity, and it's important to look at what we call the health labor market. This helps to conceptualize key elements that are needed. And the properly functioning workforce rely first on adequate education, with several dynamic and policies underpinning the education sector. And once you have a newly trained workers arriving on the market, then several pathways could exist with market successes or failure that characterize the workforce employment. And even when a health and care worker is employed, it is important to maintain the protection of health and care worker, ensuring equity. So it's not just a matter of educate and employ, it's the whole aspect of the labor market that needs to be captured to further develop the workforce. Now, we need to define who are the health and care workers. And sometimes colleagues are asking, okay, but could you tell me what is the MCA workforce, the surgical workforce, the non-communicable disease workforce? And actually, we always come back to the same workers, such as medical doctors, nurse, midwives, lab technician, community health workers. So it's important to understand that in each country, you will not find a specific emergency workforce or a cancer workforce or a diabetes workforce, but you will find these health occupations that are more or less involved in the activities. And to illustrate this concept to the next level, we are often asked about the public health workforce. And for this, we need to have an involvement of these health occupations that I described, but also non-health occupations such as wash technician, road safety personnel, and also other occupations involved in public health, which are epidemiologists. So to better define and support the workforce to implement essential public health function, the WHO and several partners developed a roadmap, and this roadmap is helpful for you to understand later the workforce development tool for One Health presented by colleagues. The vision of the roadmap is the following: a strengthened workforce in every country, delivering all the essential public health function, including emergency preparedness and response for UHC, health security, and improved health and well-being. And you can see that we have already involved several partners from different countries throughout the world on this global agenda. And this roadmap helps the alignment with various initiatives and partners. And you have example in this slide. And because the roadmap is fundamentally expanding the scope beyond the clinical workforce, it is supporting the One Health approach to the workforce development. The proposed conceptual approach to workforce development is to have these three action areas. It starts with defining what are the essential public health functions. As a second action area, identifying the skills and the competencies required to deliver this function and strengthen competency-based education. And as a third action, it is to map and to measure, to count the occupations that are engaged in the delivery of these functions and services to estimate the size and their profile. So as mentioned earlier, the workforce that is delivering the essential public health function can be seen as three broad groups. So in the middle, you will have the core public health personnel. So these are personnel working exclusively on public health. The second group, you will find health and care workers. They spend a share of their time on public health function while performing their usual clinical social care tasks. And the third group are occupation allied to health, which is a wider group outside of the health and care sector, and it includes workers on water and sanitation, food supply chain, transport, animal health, etc. So this is the overall conceptual approach to the workforce development that you will find later seen applied with the animal health. So if you want to know more about the workforce capacity for public health function, there is a collection here that includes 3 technical tools, one for each action area, and an operational handbook to guide and contextualize the implementation at national level. And you will see from colleagues how the workforce development operational tool is following the same logic for workforce capacity for zoonotic disease. And I thank you for your attention.
Thank you very much, Dr. Matthew Boniel, for giving that overall presentation, short but very, very relevant, and setting the scene perfectly for our next speaker, Dr. Im, who will now talk about the tool that we mentioned earlier. Also, before I hand over to all the participants, we do have French interpretation for those of you who would like to. So if you go on the bottom of your screen and click the globe, you will get French interpretation there. And also to remind you, we're very happy for you to discuss any issue regarding this topic on the chat, but please keep it relevant to the topic. Please do not mention anything else on the chat. Thank you. Over to you, Anne, for the workforce development tool.
Thank you very much, Supriya. And thank you everyone for joining, especially Dr. Stella, Stefan, and the EPI WIN team for making this webinar happen. For me to be able to introduce to you, to the audience, about this workforce development operational tool. The full name of the tool is the Workforce Development for Effective Management of Zoonotic Diseases, an operational tool of the Tripartite Zoonosis Guide. And that's a long name. That's why we have a short name for it, the Workforce Development Operational Tool. And this tool has been developed, as Matthew and Dr. Stella has mentioned, that by the Tripartite, the WHO, where I represent, and the Food and Agriculture Organization of the United Nations, FAO, the World Organization for Animal Health, or WOA, and also UNEP, United Nations Environment Program, also contributed greatly to the materials of this particular operational tool as well. So right now is a tripartite tool with a contribution from UNEP, but hopefully in a few years' time, this will be completely quadripartite. So before we go on to talk specifically about the workforce development, I would like to mention the Tripartite Zoonosis Guide, which is one of the backbones of the work that we worked on. The Tripartite Zoonosis Guide provides the best practices to tackle zoonotic diseases in countries, best practices in different technical areas. And the tripartite together have developed and implemented and used different operational tools to support countries to implement those best practices in different technical areas. And the areas in which there are red checks in front are the operational tools that we have launched, implemented, and used in different countries already. And One Health coordination mechanism, surveillance and information sharing, joint risk assessment, and most recently, operational tools on workforce development and monitoring and evaluation. They were launched just in December last year. And we will now talk more about the workforce development. But before I go there, I would just like to mention that there is another operational tool, coordinated investigation and response, that is being produced at the moment. And we hope to launch it in this year. So now we move on to the workforce development. Why do we need this tool? We realize that most countries already have workforce development plans, efforts, initiatives, and they have been implemented in the countries, but most of them are sector specific. That's why we see the opportunities to develop an operational tool to focus on strengthening the workforce competencies to work across sectors and discipline, most specifically to manage zoonotic diseases. But the competencies that you can see in this tool, you will see that they can be applied to other One Health challenges as well. So this particular tool look at the interlinkages across different sectors, which are highlighted in the darker linkages on the right-hand side. So the conceptual approach that we see, and we have adapted from Matthew's work. So this is the conceptual approach of the workforce development operational tool, which is the approach adapted from the WHO's public health and emergency workforce roadmap. You can see that similarly, we have at the core of the tool, defining the functions, which are looking at the tasks, the responsibilities, the work that needs to be done to manage zoonotic diseases. And then after we know the what needs to be done to manage the zoonotic diseases, we go on further to identify the pink box, the occupations, or the who exactly needs to deliver those functions to manage zoonotic diseases. And after that, we look at the blue box, the education and training of the workforce, or those people who are delivering the functions, to see whether they have competencies or if they are competent, and if the trainings and education needs to be strengthened. So those are the three core areas of what this operational tool focuses on. But we also provide resources and tools for countries to be able to look at the qualification and quantification of the workforce as well. But because there are resources developed by different organizations, including the quadripartite already available, countries can be directed to use those resources more specifically if they need to. So another visualization of what I just mentioned. So for workforce development, we cannot address everything that are on the horizon for workforce development. So this particular tool focuses on the functions. We look at the institutional functions, not at the individual level, and the people who deliver the functions and their competencies. However, this tool also provides resources to address other areas on the pie chart as well, but those resources have already been developed, as I mentioned. So those enabling areas of enabling factors for workforce development includes, for example, standard operating procedures, funding, political will, labor market analysis, as Matthew has mentioned. So you can go and look more deeply and use those tools specifically if you would like. So who exactly did we create this tool for? Because the tripartite, the quadripartite, we work with member states and member countries. So we looked at the government workforce specifically. However, we received comments and feedback that in a lot of countries, there are private sector, academia, and also the NGOs who contribute significantly to the workforce as well, especially to manage zoonotic diseases. So if that applies in your countries, please do include them in the use of the tool so that the analysis and the recommendations are as comprehensive as possible. So when we talk about zoonotic diseases, when we talk about One Health, so the traditional sectors that are involved are the Ministry of Health, Ministry of Agriculture, and Ministry of Environment. But we do encourage to include other disciplines as well. For example, the social scientists, policy, communications, or non-health sectors that Matthew had mentioned earlier. As I mentioned, this is for the benefits of the country so that you have the analysis and the recommendations that are as comprehensive as possible. So next, a little bit about the tool development timeline. So we started back about 2.5 years ago in May 2022. We convened a technical working group members from the tripartite organizations plus an NGO called Unlimited Health based in the UK. And since then, we started the monthly meeting to come up with the approach for consultation. And then we had 3 pilots in Ethiopia, Albania, and Kazakhstan. As mentioned, that after that, we also have a training of trainer for 12 West African countries in Senegal in August 2024, and also have an implementation workshop in Cote d'Ivoire afterwards. And we have two speakers afterwards about these two specific workshops. So please stay tuned. As mentioned, the Workforce Development Operational Tool has most recently been launched in December last year, together with the Monitoring and Evaluation Operational Tool. So that's a little bit of the technical development piece. Again, to remind you of the conceptual approach of the operational tool. So the functions, occupations, and the education and training, and a little bit about the enabling environment, including the qualification and quantification of the workforce. And this conceptual approach has been translated into the 10 steps of the tool. I'm not going into the details of all of these 10 steps because we don't have time. But I would like to remind you to look at step 4, which is the functions, step 7, the competency packages, and the training and resources at step 8, because these are the main part of the tool and the comprehensive analysis that we did. So for step 7, the competency packages, just to let you see how much that we've looked at. So we looked at all of these 23 competency frameworks and synthesized, consolidated the competencies that are relevant to One Health, working together between different sectors, and those that are relevant to zoonotic disease management. And we managed to synthesize the competencies into 36 competency packages that are included in our operational tool. For step 8, for training and resources, so these are some examples of the resources that we drew from. So mainly we looked at the quadripartite and UN agency resources, in particular FAO, UNEP, WOA, and WHO, including International Labor Organization as well. And for other organizations' resources that we included, they are from US Centers Disease Control and Prevention and European Centers for Disease Control and Prevention, and also Siahun, Southeast Asia One Health University Network, and many more. So this is to let you see some examples of the information that we drew from and analyzed to include in this operational tool. So I'm not going on further. I would just like to conclude with the links that you can find more information on, and we would be happy to answer any questions in the end. So thank you again for joining this session.
Thank you very much, Dr. Aim, for this wonderful overview and, truly a well-coordinated effort here that's going to be very useful. So now you know about the tool, but how is it used? How can you practically use it? For that, I'd like to invite Dr. Virgil to talk to us about the Training of Trainers workshop in West Africa to operationalize this tool and the findings from there. Dr. Virgil, the floor is yours.
Thank you so much, Dr. Supriya, and dear colleagues, ladies and gentlemen. It's a singular honor for me to take the floor this afternoon and share with you the West African Health Organization experience in deploying the workforce development operational tool in West Africa from a regional perspective, actually. So this afternoon, I will be structuring my talk around 5 important pillars. I will first of all present in the background the One Health foundations on which this tool has been deployed, recall the objectives, and I will explain briefly the workshop proceedings and present the outcome we have gained, and also share some recommendations for potential users of this tool. So basically, in West Africa, we have started implementing the One Health agenda since around 2006, but we can look at the One Health implementation in this region of the world in basically three phases. We have the inception phase, where country has started initiating slowly multi-sectoral coordination mechanism, but we really started One Health implementation after the Ebola outbreak in 2014 and 2015 Ebola outbreak from the Dakar consultation meeting jointly organized by WHO, WAHO, and many partners in the regions. So in 2022, after organizing several workshops and initiative in West Africa, we have established a One Health strategy and a governance manual. And this governance of One Health in the region is based on a key institutions and agencies that should play a critical role for fostering collaboration among sector through a regional One Health secretariat, supported heavily by the One Health quadripartite at a regional level through a One Health advisory board in place. And I have to draw attention to the fact that we have implementation both at political level, operational level, but technical level through establishment of several technical working group. And the third, one of the important several working group, the third from the left, is about workforce development. And the first time at WAHO, when we saw that powerful tool developed by WHO, we were excited because it appeared as a true opportunity to operationalize that technical working group at a regional level. So the tool really proposed here aims to enhance workforce competencies in zoonotic disease management. It really promotes integrated approach to health through collaboration and coordination among the sectors. But why do we use workforce development operational tool at regional level? First of all, it was really a foundation for us to develop a future workforce development strategy among ECOWAS member states. We also use this tool because it will help to improve collaboration and coordination among sectors, and also to make sure that local and available evidence are incorporated in the deployment of the tool. The objective of the meeting that we have conducted in West Africa was to make available to member states skilled trainers capable of deploying the tool both at national level, but also to reflect of the regional context as well to advance the One Health operationalization. This has been possible with the support of the quadripartite, and we work closely with WHO, OIE, FAO, and the Regional Animal Health Center from ECOWAS as well. So the workshop took place in August last year, 1 week after the declaration of the mpox as a public health emergency of international concern. And the workshop was structured around 3 days interactive sessions to enhance participant engagement and learning. We gather around 70 participants from different One Health contributing sectors, and it was several presentations and group exercise have been organized to present the tool, but also to help participants to reflect on the regional context. So one of the interesting parts of the deployment was actually the simulation exercise. And since we were under the mpox response, at that time, we used a scenario, a scenario based on the mpox situations, in order to improve also our mpox readiness at the same moment. So the exercise was based on the specific workforce functions, and it triggered also some discussion among key sectors and action to be taken to deploy the tool, but also to improve our response to the ongoing epidemics. So the tools permit us to enhance our multi-sectoral collaboration, the Regional One Health platform, to let partners have an agreement on how to improve workforce development in our regions, and also to build synergy with the quadripartite and other actors in improving the collaboration between human, animal, and environmental sectors. So what were the challenges? Because as a new tool, we were facing a number of challenges that are needed to be shared here. The first one was the capacity building. It was a new tool, so it is required that we organize a facilitators meeting to make sure that we have a critical mass of actors that can discuss and understand the sense of the deployment of this tool. It's also required to have a virtual session prior to the workshop to make sure that all attendees were on the same ground. The other challenges we were facing as well was the lack of funding and technical resource gaps. But we believe that by proper planning, this can be easily overcome. And of course, since we are navigating in a complex system as Im just presented, and the intersectoral collaboration having these own challenges, we believe that this foundation may appear as also a challenge. But definitely collaborations and coordinations among sectors and actors is the context for overcoming those challenges. So recommendation we came up with from this experience was to integrate the workforce development operational tool in our health workers policies, to have it as a periodic exercise to be conducted to improve our workforce development strategies comprehensively. Another important point also is to use that tool to influence the resource allocation strategy. We saw many countries allocating resource for workforce development, but with fragmented evidence. And this tool is a powerful opportunity for putting together the whole picture at national and regional level to better use available resources. Another opportunity is to encourage learning through this platform and permit that we train more experts in using the tool. And at the end, I will say that fostering collaboration efforts was actually key for guaranteeing success in this experience as well. So as next step from this experience in August, we intend to continue to support more countries in deploying national workforce development tool. We will have a Cote d'Ivoire experience just following these presentations, but we expect more countries both in West Africa and other regions of Africa to have the same experience for us to compare what we are observing for member states and come up with innovative approach in advancing workforce development. Another important point is that this tool will help us to agree on metrics to assess progress and impact, as rightly said by Dr. Shugong in the opening remark. Key points as well as I must highlight in this presentation is the advocacy efforts. We should continue to strengthen effort to secure policy and funding to implement One Health, but more importantly, to support the implementation of the quadripartite tools, the unique way we have actually to bring our workforce, our national One Health coordination mechanism into maturity. And as we all do in public health, we need to keep learning for what we are doing. It's the unique way we have to improve public health actions. So let me end by saying that the time for One Health actions is now. This tool is really a step forward for us, both human, animal, and environmental health sector. And we need to take this opportunity to empower a resilient workforce for a healthier and safer future. And I want to especially thank colleagues from WHO for the leadership and the facilitation in this exercise. We need to work more together by building synergies in the implementation of the One Health Joint Action Plans is possible, and this workforce deployment tool is really a practical example. It's a testament for this success, and together we can build a robust One Health workforce for a heavier and interconnected work. I thank you so much. I really appreciate the opportunity. Over to you, Dr. Supriya.
Thank you very much, Dr. Virgil. Thank you for the detailed explanation of the TOT and the challenges faced, and it's also that you need to work on, and also talking about how it brought together different partners for the coordination. Now we will, as you mentioned, I'd like to request Dr. Guy to share the experience at the country level, Côte d'Ivoire. You know, we've heard about the training of trainers, and I can see there's some questions as well on the chat and how that's moved forward. So over to you, Dr. Guy, the floor is yours.
Yeah. Bonjour tout le monde. Allow me to present in French. That is another way. That is part of the One Health. So, merci beaucoup. J'ai le plaisir de vous présenter un travail d'équipe effectué en Côte d'Ivoire, par plusieurs personnes et financé essentiellement par Afro-UN Côte d'Ivoire. Il faut dire que nous étions déjà en train de travailler sur le problème du personnel One Health en Côte d'Ivoire quand on a eu cette opportunité de formation et quand on a eu la possibilité d'utiliser cet outil en Côte d'Ivoire. Alors, tout est parti de la JEE effectuée pour la deuxième fois en Côte d'Ivoire en décembre 2023. Et on a constaté qu'en particulier pour le domaine D3 des ressources humaines, encore D3, 4, où la Côte d'Ivoire a eu 5 ans plus tôt et 1 en 2023. Voilà pourquoi Afro-UN a décidé de soutenir les ministères clés à travers dans le pays pour pouvoir passer de ce 1 à 3 en recrutant des consultants. Ces consultants ont travaillé sur différents thèmes et vous verrez que tous les thèmes sur lesquels nous travaillions tournaient autour du problème de ressources humaines, que ce soit le renforcement de capacités, que ce soit la stratégie, que ce soit les politiques. Nous avons eu 5 consultants qui ont fait ce travail. Alors, si nous passons à l'organisation même de la réunion, les participants, nous avions 39 participants et nous avons travaillé pendant 3 jours et demi. Voilà la répartition par sexe, 30 hommes, 9 femmes. Si vous regardez ici, ce sont les professions, vous verrez qu'il y a une grande représentativité, que ce soit des médecins, des vétérinaires, ressources humaines, des spécialistes en plantes, etc. Tout le monde était représenté. Et nous avons aussi regardé par secteur. Le secteur animal était là, le secteur humain était là, l'environnement, les plantes, etc., des chercheurs également. Voici les facilitateurs qui ont participé en août à la formation du Sénégal et qui sont venus mettre en place cette formation en Côte d'Ivoire. L'objectif est de contribuer au renforcement de la capacité impliquée dans la gestion des maladies zoonotiques en Côte d'Ivoire. Nous avions également des objectifs spécifiques. Au nombre de 6 ou 7, nous allons en passer. Alors, pour préparer le travail, pour préparer l'atelier même, nous avons plusieurs étapes. D'abord, la cartographie personnelle dans l'approche Une seule santé. C'était un très, très bon travail effectué par M. Badjer en Côte d'Ivoire. parce que c'était l'approche One Health. En général, vous aurez des documents parlant du secteur de la santé humaine, du secteur de la santé animale, etc. Mais là, le document de M. Badger, c'était l'approche One Health. Deuxièmement, c'est le recrutement des consultants qui ont mené les travaux. Allô? Vous m'entendez?
Yes, we can
Allô?
hear you, Doc.
OK,
Yes, we can hear
d'accord.
you.
OK. Donc, le recrutement des consultants, suivi d'un atelier de 2 jours pour que nous soyons d'accord sur les problèmes. Et nous avons rencontré à mi-terme tous les consultants également pour discuter. Et c'est après ça que, vous voyez, nous avons participé à la formation de Sally. Et puis, nous avons fait également d'autres formations. Donc, pour la méthodologie, nous avons utilisé l'outil opérationnel Workforce Development dont on parle ici, en particulier les étapes 1 à 9, parce que l'étape 10, suivi évaluation, nous avons projeté de faire ça plus tard. Nous ne l'avons pas encore fait. Le déroulement, je parle ici, le premier, c'était avant le module 1, donc disons module 0, c'était l'approche One Health, l'approche Une Seule Santé, parce qu'il fallait expliquer à tout le monde tout ce qui était là. Certains n'étaient pas familiers au One Health, il fallait leur expliquer de quoi nous voulons parler. Donc le module 1, l'étape 1 et 2, c'est la présentation des ressources humaines One Health dans le RSI. On a constaté qu'il y a une insuffisance de personnel dans la santé. Le module 3, le module 1 toujours, étape 3, qui analyse la situation. C'est ici nous avons utilisé la cartographie de M. Badger. On constate qu'il y a une insuffisance de ressources humaines aggravée par une inégalité de répartition des professionnels de santé sur l'ensemble du territoire. Et on a vu que la plupart de ces professionnels, quand ils existent, sont dans les zones urbaines. Le module 2, étape 4, c'est la sélection et la révision des missions prioritaires. Eh bien, nous avons choisi dans la liste, nous avons choisi 10. Et ces 10, vous voyez ici que ces 10, il y en a que nous avons corrigés, il y en a que nous avons fusionnés. Toujours est-il que nous avons pu aller au bout. Alors, l'étape 5, toujours en allant dans l'outil, c'est faire correspondre et classer les fonctions aux missions prioritaires. Nous avons ajouté à la liste que nous avions, la liste des fonctions que nous avions, nous avons ajouté ce qui manquait. Et en particulier, vous voyez, le dernier, c'est la santé des plantes. L'outil ne parlait pas de santé des plantes. En Côte d'Ivoire, nous considérons la santé des plantes comme un secteur à part entière. Ensuite, nous avons croisé les fonctions et les missions prioritaires et nous avons sorti les points faibles par secteur, comme vous le voyez ici. L'étape 6, c'est l'identification des besoins et des défis en matière de personnel, ainsi que les environnements. Et c'est ce tableau qui va nous donner, toujours par secteur, tous les différents points. Encore, nous avons évalué les compétences requises par les missions prioritaires en étape 7. Tout ça, c'est nous suivons la procédure de l'outil. Ce qui nous donne que nous avons ici les 20 paquets, sur 23 ou 25, nous avons 20 paquets qui ont été considérés et 20 paquets où les experts ont décidé de chercher des besoins de formation. Ici, c'est la représentation par secteur, secteur humain, secteur animal, et chaque secteur avait bien sûr ses besoins propres. Alors, l'étape 8 va nous permettre d'identifier les ressources pour renforcer les paquets. Nous avons trouvé au total, en fusionnant tous les secteurs, 149 références. C'est 149 références. Nous avons tenu compte ici de certains critères comme la langue, parce que beaucoup de documents sont en anglais, il y en a en arabe. Nous avons choisi ce que nous pouvons et nous avons 149. Mais Afro-UN Côte d'Ivoire ne s'est pas arrêté là. Là-haut, vous voyez que sur les 149, Afro-UN a décidé d'organiser un deuxième atelier qui permettait de valider ces ressources que nous avons trouvées. Ainsi, nous sommes partis plus en profondeur et nous avons pu ramener les 149 à 56 documents, 56 références plus claires. Ça, c'était un deuxième atelier. Les facteurs retenus, c'est la duplicité, hein, l'approche une seule santé, mais on n'a pas toujours trouvé des documents approche une seule santé, mais on les a sélectionnés, la langue et bien sûr la formation locale. Nous avons souvent des formations locales que nous négligeons. Ces formations sont représentées ici en bleu et ceci avec les compétences. Nous comparons ça aux compétences. L'étape 9 nous a permis de faire des recommandations comme la sensibilisation des autorités, la prise en charge des activités multisectorielles, l'élaboration d'un plan multisectoriel, etc. Et pour les prochaines étapes, c'est la mise en place d'une base de données comprenant les profils et les compétences, le renforcement de capacités multisectorielles, la communication intersectorielle, le plaidoyer aussi auprès des autorités et le financement qui est toujours le problème. Alors, qu'est-ce que les experts ont pensé de cet outil? Je vais y aller rapidement. Nous leur avons demandé d'évaluer 5 éléments. Vous verrez qu'ils étaient très satisfaits ou satisfaits de ce qui a été fait. Les points positifs qu'ils ont vus, la méthode de travail, la méthode de travail et l'organisation, la qualité des interventions des facilitateurs, les exercices, voilà. Ensuite, l'impact de cet atelier, ils estiment que c'était un impact modéré à un impact très important. Est-ce que l'atelier a répondu à leurs attentes? Je pense que nous pouvons dire 71% ont dit bien, 14% ont dit excellent, donc ils étaient satisfaits. L'évaluation de l'outil même, vous voyez ici qu'ils sont de satisfaits à entièrement satisfaits. Donc, je suppose, il veut dire par là que l'outil est très bien conçu. Et selon vous, quelles ont été les principales faiblesses de l'outil? Si je me mélange, ben, c'est l'absence du volet santé des plantes, parce que la santé des plantes, je dis encore une fois, n'y était pas. La langue, beaucoup de documents sont en anglais, par exemple. La difficulté de compréhension de l'outil, à un moment donné, surtout la dernière étape, il parlait de l'étape 9. La formation proposée, les formations proposées ne sont pas adaptées à notre réalité. C'est ce que nous avons réussi à faire en ramenant ce qui a été des références à un nombre plus intéressant pour que ce soit vraiment ce qu'ils veulent. Et selon vous, quels ont été les principaux points forts de l'atelier? La flexibilité de l'outil, le paquet de compétences, le caractère holistique et les bases de données, les exercices. L'outil est adapté à la formation, il est dynamique, la détection de besoins selon les secteurs, la participation de toutes les composantes du OneF et les modules. Recommanderiez-vous cet outil à d'autres pays? Ben, 70%, 66% disent absolument et 33% disent probablement oui. Ça veut dire presque tout le monde a dit c'est très bien. Ils vont recommander. Voilà. Quelles sont les principales leçons apprises lors de cet atelier? Le concept OneF est primordial pour la gestion des urgences. Nouvelle procédure d'évaluation des ressources humaines dans le cadre de la gestion multisectorielle et cela permet de gérer les crises, etc. Commentaires supplémentaires, ben, ils disent d'accorder plus de temps lors du déroulement de l'outil afin de permettre aux participants de comprendre l'outil et faire une large sensibilisation des décideurs. Les documents sont en anglais, donc en commission, nous sommes obligés d'expliquer. Désolé. En commission, nous sommes obligés d'expliquer à ceux qui ne comprennent pas anglais. Cela dit, je vous remercie de m'avoir écouté et nous sommes prêts à répondre à des questions. Merci.
Thank you very much, Dr. Guy, for detailing the efforts in Côte d'Ivoire. Now we come to the important part, the questions. And I can see there are quite a few questions on the Q&A box. So we'll start with the early questions first. So I will start with asking the panelists, is there any cases of comprehensive taxonomy on the country level for the public health workforce and or One Health workforce? This question is from Carolina Ira Petian. I hope I've pronounced your name right. And I throw it open to all the panelists. Is there any one of you who would like to answer that? Maybe Dr. Matthew, maybe? Or anyone else, or Carmen?
I can give it a try if you want. So there is what we try to do when we are talking about workforce is to look at the occupations that are doing the different tasks and activities, and we usually rely on the international standard classification of occupation to define which are the occupations involved in providing the services. And as you have seen, and it's related probably to the second question about potential power imbalance and how we ensure the equitable collaboration, is that we are not starting from specific occupation. We are always starting from defining functions, and from there then identifying which are the occupations that are delivering the services. So to the way you define the occupations and the workforce is really at the international level, this international standard classification, and at national level, you have equivalent type of taxonomy that exists to define the occupation with the specific country's definition, etc. Usually, you will find that nicely from the National Statistical Office, but also with partners that can help defining properly which are the workers involved in these activities.
Thank you, Dr. Matthew. Is there anyone else from the panelists who would like to add or has any other views? Or shall we go on to the next question?
Yes, Supriya, if I may add.
Yes, please.
Just to mention that in addition to Matthew's work on public health workforce, within the workforce development operational tool, we proposed a list of occupations who would be involved in the zoonotic disease management. We don't call them One Health workforce because we are thinking of the workforce specifically for zoonotic disease management. So we propose a list for occupations in public health, in animal health, in wildlife, and in environment, as well as the other occupations, which in Matthew's term could be non-health occupations. So, but just to keep in mind, this is a very broad framework that we propose to countries, and it's up to countries to adjust, adapt, or propose others in the list. Thank you.
Thank you so much, Dr. Aim and Dr. Matthew. We have now a question specifically for Dr. Virgil, and it is from Dana Abeldinova. I hope I've got the name right. The question is, how are you planning to roll out the operational tool at national level? Whose support is more important for this process? Should it be MOH-led, Ministry of Health-led, or other sector?
Okay, thank you so much, Dr. Supriya, for the questions. I believe that Dana got it well. I thank her for the interest to this important topic. We keep advocating for One Health implementations as part of our national action plan for health security in different member states. But at the regional level, WAHO has also developed an ECOWAS One Health strategy that is regularly funded by existing projects we have at the regional level. So this current workshop, regional workshop we have presented, have been funded jointly by different partners, WHO and WAHO and other contributions for other partners as well. But we believe that we continue the advocacy to roll it out. The Cote d'Ivoire's experience has been funded by domestic funding existing at Ivory Coast as part of the National Action Plan for Health Security. So we encourage other countries also to place these efforts within that framework. It's the best way to get funding to move forward One Health activities and other health security activities. It's difficult to say it's MOH-led activities or animal health sector-led activities. I will say that it should be a national One Health coordination mechanism-led activities. That was the positive experience we have in our regions. Most of our countries have established a national One Health secretariat. And within that secretariat, we have represented all sectors. So we usually recommend that the secretariat take the lead. They have the governance operations, who should take the leadership, invite other sectors. They have the role of operating. So we place these activities within the existing framework at national level to ensure ownership and also consistency for all actors to contribute. So in ECOWAS at the moment is WAHO that is ensuring the lead of the One Health Secretariat. Therefore, WAHO has taken the lead of these activities. But other departments within ECOWAS has also contributed, and I believe it was the same case with Ivory Coast as well, where public health sector took the lead. But it's up to other sectors and other countries, based on their own context, to decide who is best placed to lead this effort. But all in one, we believe that the task force to be put in place to roll out this activity must encompass all key contributors at national level to make sure that robust discussion happens and conclusions are shared by all parties. That's what I can say to address this concern. Thank you, Dr. Supriya. Hello, Dr. Supriya, can you hear me?
Yeah, apologies, I was on mute. Thank you very much for that comprehensive answer. There are quite a few questions for you, actually, Dr. Virgil, but I will now move on because of time issues to another question, which is about there's a question on the private sector, the use of the private sector. How can private companies work in this area? Would the panelists like to answer that?
May I address this in a broader
Yes.
sense, if I may?
Yes, please. Yeah.
So, in the context of our tool and WHO's tools or guidance, I think we provide a very broad framework for countries to apply. For example, the Workforce Development Operational Tool provides suggestions or proposals what countries might want to look at in terms of their workforce, and the trainings and resources that we include in the tool are at the regional and international level, so global level or regional level. However, at the country level, the best person who can work on and also to address such as the resources or the analysis is yourself, because we don't have the capacity to address the context at the country level. So I would encourage, and I think this is applicable to different topics, not only the private sector involvement, but also the advocacy for resources using the results or the analysis from the tool or the guidance, also the community volunteers, community engagement. I think all of this applies in the sense that the guidance, the tools that the tripartite or WHO provides or suggests are at the global level, that you can look at more deeply at the recommendations, at the proposals, at the suggestions, and then look at the context in your own country to see how this could apply and how you get the communities to be involved, to get the private sectors to be involved. And the use of the tools or guidance provides the documents or evidence for you to be able to advocate for resources, either within your countries or at a regional level. So I'll stop there. And I think I addressed the questions, about 3 or 4 questions there. Yep, thank you.
Indeed, there were a few questions on some other questions as well, and that's great that you could address all of them. Another question that we had was on the different tools. There's a question from Damilola Kolade from Nigeria CDC, Dr. Damilola Kolade, who's asking, can facilitators help clarify what are the key differences in terms of approach of implementation for the COHFE tool and the WFD tool, seeing both tools are focused on One Health workforce development?
Can have a try on that. And I know that the members from COFFEE or Competencies for One Health Field Epidemiology Framework are also on the call. So if you have anything to add, please feel free either to type, or I'm not sure whether you're able to speak up. So I'll try first, and then if you would like to add, please feel free. So our tool is a very, we look at a broad workforce for everyone who are involved in zoonotic disease management. So different sectors who would work across sectors to tackle disease management. And we did the analysis. We also included the framework, the COFFEE framework, the competencies for One Health Field Epidemiology in our analysis as well. So I would say in a very short term, so we are a broader tool, and the COFFEE framework focuses specifically on the field epidemiology, which we focus on different things. So for COFFEE, it's field epidemiology. For us, it's the workforce to tackle zoonotic disease management. However, there are some overlap areas, of course, and countries can choose to use the two tools a little differently. One way to do it, and that the COFFEE team and our team have discussed, is that to use the workforce development operational tool, which is broader, to look at whether there is a need to look at the field epidemiology framework more closely. So for this option, you would use the workforce development operational tool before to look at a broader workforce, and to look at whether there's a need to look at the field epidemiology framework more closely. Yeah, and then you use the COFFEE framework to develop the field EP curriculum afterwards. I'll stop here, and if the team has anything to add, please feel free. Thank you.
Thank you for that. Does anyone else want to add anything? So it's, you know, no?
I believe she covered it very well.
Thank you.
Yeah.
We're now short of time, but maybe we could have one more question. I'm just looking at the questions right now. There's another question that talks about community engagement. I think Dr. M addressed it a little bit. Jean-Vivian Mumbuli says that from past experiences with Ebola and monkeypox, I find it essential for One Health to work properly, that community level actors be engaged for the empowerment and surveillance and IPC action. Has this been included in the training curriculum? Maybe Dr. Aim and also Dr. Virgil and Dr. Guy, from your experiences, very quickly.
I would open it to Dr. Guy, and if for the experience in country. And I would add, yeah.
Sorry, I had a
hello?
break because of my internet. Can you repeat the question, please? My internet is not good.
No problem. The question is that the role of communities for One Health, and is this
Yes.
being included in the tool and the training?
Yes. Can I start, please?
Yes.
Maybe just before Guy. First of all, I want to appreciate the question for Dr. Jean-Vivien Mumbuli. We have worked together during Ebola response in Guinea a couple of years ago, and I share totally the point he has made about the One Health approach at community level. First of all, we need to recognize that this tool, as it is now, focus more on the health sector and other contributing sector as well, but not totally on the One Health on the community level. Number one. Number two is that at community level in West Africa, at least, we are reviewing the curriculum, the training curriculum about the training package for the community health workers, including a One Health aspect to improve surveillance, early detection, IPC, and other critical component that must be, I can say, monitor at the community level. In that regard, a joint task force in place in West Africa, made of WHO, UNICEF, WAHO, has been put in place. And I believe in April this year, a regional meeting will be set up to validate the existing draft of implementing One Health concept at a regional level for easing early detection, prevention, early detection, and response at community level. This work has been done under the directive set up by the technical by the Continental Task Force set up by Africa CDC to orient effort at the community level as well. So I believe it's under that framework that the question of Dr. Mumbuli can be consistently addressed. At the country level, at the moment, we can say that we are observing different level of implementation. Some are having a more a vertical and sectoral approach, but we believe that we believe and we agree that there is a need for a more, I can say, cross-cutting approach to mutualize resources and also to maximize impact at community level. I thank you.
Thank you very
Alors,
much. Dr. Guy, you want to add there?
Yes. Donc, comme vous l'avez vu, cet outil, c'est d'abord pour le personnel du One Health. Donc, il sera plus orienté vers ce personnel du One Health et certainement par la suite, on pourra descendre au niveau communautaire. Cela dit, en Côte d'Ivoire, en plus bien sûr de ce que nous avons fait, il y a la plateforme Une Seule Santé qui fait du très bon travail au niveau communautaire. D'accord? Vous avez vu que parmi nos participants, nous avions par exemple le ministère de l'Intérieur. Ils ne sont pas là par hasard parce que c'est eux qui gèrent au premier chef les communautés. Donc oui, cela a été fait au niveau central. Ça sera dans un premier temps pour le personnel de la santé, approche One Health, mais par la suite, on pourra faire des programmes au niveau communautaire. Merci.
Thank you. Over to Dr. Ayn.
Yes, so I think it's the same answer. I don't have much to add, but just to mention that please include the communities or any sectors that you think would contribute significantly to the workforce in order to address One Health or zoonotic disease management. Thank you.
there are many other interesting questions, but in the interest of time, we've now actually run over time. We would have to stop here, but I'd like to thank everyone. First of all, I'd like to thank all the participants for your interest and your questions. We hope this tool will be of interest to you. And if you use this tool, we would love to know how you're using it and how you find it useful. I'd then like to thank each and every one of the speakers, Dr. Stella Chunglong, Dr. Virgil, Dr. Guy, Dr. Aim. We also have, as you can see from the room in WHO where Dr. Aim's speaking, we have Dr. Stefan, who's kept in the background, but who leads much of this work. And we also have other colleagues there, Dr. Carmen, Dr. Graham, and others. So thank you very much for all the work, for working in the background. I'd like to thank my colleagues, Dr. Sophia Song, who's been interacting with you on chat. Then Michael and Burke, who works in the background with the logistics, the IT team, and last but not least, Project Echo, Kanika and Constance in particular. So as you can see, there's a lot of people working very hard to make this webinar happen. Finally, I would like to just add that we do have upcoming EPI WIN webinars. So please do join us next time. Let me just share my screen. I've also put the PDF version of that on the chat, but these are the upcoming webinars as of now. We will probably have more, and we will let you know as we organize them. But as of now, these are the confirmed webinars till March, but we will keep you updated. You will have all the recordings and the presentations shared with you over time. And we will also let you know about a lot of you have been asking questions about certificates. I'm telling you right now that we will share the certificates for you, but only to those who indicate they want a certificate and respond to our survey within 24 hours. We are trying to sort the issue with certificates, so bear with us. It may be slightly delayed, but you will get it. Some of you who feel that you haven't got it, please check your junk mail boxes and other email boxes in case it's stuck there, because for those who have attended and responded to our survey and asked for a certificate, we have sent it for 2024. And with that, we conclude our first EPI WIN of 2025. Thank you for attending and look forward to seeing you next time. Thank you.
Thank you very much.
Thank you. Bye-bye.